Hello, and welcome to another post from Dr. Blake's Healing Soul. This is Dr. Rich Blake on location in Hawaii. Today I want to talk about conservative treatment for bunions. Bunion pain is a very gradual spreading of the foot, and it is important that in all enclosed shoes you use some form of toe separator. Usually I'll have my patients get medium gel toe separators or large foam toe separators, and that really keeps the toe in good alignment while they're walking. For home, 30 minutes a day of yoga toes or one of their knockoffs is a extremely good way of keeping the tissue loose. If you're very, very tight between the first and second toes, you can try to use a night splint. Foot Smart has probably the best one on the market. But before you ever try to sleep with it, you should try to wear it for 30 minutes and then an hour, then 2 hours during the day when you're reading a book, etc. You should do foot intrinsic exercises like metatarsal doming and single leg balancing to keep your foot as strong as possible, and start looking at abductor hallucis strengthening exercises, which can help get that muscle firing while you are walking. If you tend to pronate, that puts a lot of pressure on the bunion, and it's important to have orthotic devices that shift your weight into the more center of your foot. For those who don't pronate, it's not a vital part of the treatment, and sometimes it's some sports that you do. I have patients that when they run they pronate terribly and really beat up on their bunion, but when they walk they're just fine, and they stay very centered. So it can be a very good part of it. If you're having redness around the bunion, you can definitely do ice massage. You can use just aloe vera and vitamin E creams or softening creams, and 2 or 3 times a day massage that tissue to revitalize it and get rid of the stagnant blood and make it healthier. And that way it's less irritable. And select shoes that are very wide across that area, at least don't have a strap that cuts across it. Get some 1/4 inch adhesive felt from moremedical.com, and that can take pressure. You put it not over the bunion but just behind the bunion towards the arch, maybe an inch square of it, and it will allow you to wear shoes, a lot more shoes that would tend to hit the tissue. Okay, so I hope all these tips are helpful at keeping your bunions stable, less painful, and actually revitalized by getting rid of some of that stagnant blood. Thank you.